New patient in the house. This is a hatching year male red-tailed hawk with an old compound fracture of the Carpometacarpus, which is at the end of the wing. And it's an important piece of the anatomy because that is where the primary flight feathers emerge. And the top bone is broken in the middle. The bottom bone is broken in the proximal, close, like right at the joint. So when these bones don't work right, then he can't control the important part of the primaries. So anyway, I don't know about his releasability, but it sure would be nice to have him as an education bird. He's small. He'd be easy to handle. The males are just so much more stable than the females. I hate to admit it, but it's just true.
I know, you're just so pretty. It's okay.
Now he's in a confined crate, but this is an old break, and there's really nothing. Even if it was a fresh break, there's really nothing you can do about it because those bones are so small. But he's going out in the big boy chamber today. I have given him some medication for parasites, so I don't smell those anymore. When you've been doing this long enough and you smell their mutes, you can tell whether or not they have parasites. And some of these, not only first-year birds, but adults too, they come in and sometimes they just have a bad case of parasites, and all they need is a little medication for that. Keep them for a couple of weeks, fatten them back up because they've been using their body reserves to feed the parasites, and then give them one more dose, and then release them. But I don't know. I don't know about the prognosis about this guy, but if he adjusts to captivity, then maybe we can have him as a program bird.